Welcome to the step-by-step demonstration of zinc oxide eugenol cement mixing. We will begin with the instruments required, then move on to dispensing, mixing technique, and finally we will talk about its composition, setting reaction, and clinical uses. So let's get started. To begin with, let's look at the instruments and materials we need for mixing. You will require a clean, dry, and cool glass slab, a stainless steel spatula, a powder measuring scoop, the zinc oxide powder, and eugenol liquid. It is very important to ensure that all these instruments are completely dry, and even a small amount of moisture can change the setting reaction. So before you dispense the materials, make sure you shake both the bottles gently. This helps in evenly redistributing the contents, especially the powder, which tends to settle at the bottom. Now, dispense the materials separately on the glass slab. So the slab should be cool, but not too cold. We will discuss why that is important later. Now comes the most crucial part, the mixing technique. Start by dividing the powder into uneven increments. The larger portion should always be added to the liquid first. Use a stainless steel spatula and start mixing it firmly in circular motions. Initially, the mix will look a little thin, but as you gradually incorporate more powder, it will start to thicken. Keep folding and pressing the mix with firm pressure. This ensures proper blending and eliminates air bubbles. Continue spatulation until the cement appears smooth, creamy, and uniform in texture. Now, if you are preparing it for luting, the mix should be a thin, creamy flow. For restorative purposes, you will want a thicker mix, something you can roll and pack easily into the cavity. Now, a quick note on the glass slab itself. Using a cool glass slab helps in slowing down the setting reaction, which gives you more time to manipulate the material. However, if the glass slab is too cold, below the dew point, moisture from the air will condense on its surface. This water can actually accelerate the setting reaction and ruin your mix. So remember, cool, not cold. Now that you have got the technique right, let us understand what's actually inside zinc oxide eugenol cement. The powder primarily contains zinc oxide, about 69%, which is the main reactive component. It also includes white rosin, 29.3%, 1% of zinc stearate, 0.7% zinc acetate, and magnesium oxide. The liquid contains 85% eugenol, which reacts with the powder, and olive oil is 15%, which acts as a plasticizer and modifies the flow. The reaction between zinc oxide and eugenol is a chelation reaction, forming zinc eugenolate. The setting time ranges from 4 to 10 minutes, depending on the temperature and the humidity. Inside the mouth, it sets faster because of the presence of heat and moisture. Now, let us look at where this cement is actually used. Zinc oxide eugenol is a multi-purpose material. You can use it for temporary cementation of crowns and bridges, as an intermediate restorative material as cavity liners or bases, and even as root canal sealer. It is also used in periodontal dressings and surgical packs. It can even be used for permanent cementation of fixed prostheses. And that completes the demonstration on zinc oxide eugenol cement mixing. We have covered everything from instruments and dispensing to mixing technique, composition, and clinical applications. If you found this video helpful, make sure to like, comment, and subscribe for more detailed demonstrations on dental materials and clinical procedures. Thank you for watching.